I'm Dr. Charles Allen, and I'm a member of the Gastroenterology Associates of Gainesville, and I've been a member here now for 27 years. I am a resident of Georgia, and I grew up in rural South Georgia, but I finished my undergraduate degree at Berry College in Rome, Georgia. I joined the Air Force and on a scholarship went to the Medical College of Georgia and completed my studies there in 1978. I then did an internal medicine internship residency at Memorial Medical Center in Savannah, and then was assigned to Langley Air Force Base in Virginia. I served there for 4 years as a general internist and then got into a GI program with the Air Force at Wilford Hall in San Antonio, Texas. And after completion of the fellowship, I stayed on for 2 more years as a professor and instructor in endoscopy. I then left the Air Force in 1989 and came here to Gainesville to join Dr. Steve Moore, who's our senior member of our group. I'd like to talk with you today about intestinal gas and bloating, which affects approximately 1 in every 10 of American adults. So this is obviously a very common problem that we see and encounter here in our clinics. This may be a very infrequent problem associated with more of a holiday meal that's high volume food and high in fat, but for other people it can be quite chronic and even an everyday occurrence with obvious distension and bloating, and sometimes associated with significant pain and nausea. There are 2 major groups of causes for increased intestinal gas. Everyone has some gas present, but for increased volumes it may be related to ingestion, certain things that you're actually doing that actually increase the amount of air that you swallow, and that can include cigarette smoking, eating meals very fast, very rapid, poorly fitting dentures, chewing gum, and even occasionally reflux with irritation of the esophagus that causes a sensation of fullness in the throat and repeated swallowing that includes air going into the stomach. The second category relates to digestion of sugars, and these are complex carbohydrates. These can be very brief, related to a viral syndrome where you have recovery of the lining of the intestines and recovery of the enzymes over several weeks. They can be permanent and congenital absence of the enzymes or partial absence of the enzymes. Sometimes we will see this related to medications, but that's much more rare. And occasionally with age, we'll see changes with the enzyme levels. The most obvious enzymes and deficiencies and sugar digestion issues that we deal with are related to dairy products, lactose. Since there's so many different potential causes for the gas, it's obvious that the individual treatments are going to vary from person to person. The more that you can gather as far as information with association of symptoms and either types of foods you eat or even meals will help you and your doctor then decide which is the best course of therapy for you, and that might also help you avoid many unnecessary tests.